All right. Gearing up for an NHS Band 3 interview.
Exciting stuff.
We're taking a deep dive today
Yeah.
into a YouTube video from How to Become
Okay.
to help you absolutely ace it.
Sounds good.
These Band 3 roles,
Mhm.
healthcare assistants, admin positions,
Yeah.
they're like your entry point
Right.
into this amazing world of the NHS.
It's such a key starting point, really.
Yeah.
And this video, I love that it just gets right to the heart
Yeah.
of what those interviewers are looking for.
It's more than just, do you have the skills, though, right?
Exactly.
It's like you need to prove
Yeah.
that you get the NHS, its soul, its
Yeah.
whole mission.
Absolutely. And the video, it hits this right away
Okay.
with its first tip, why NHS?
Oh, interesting.
A lot of people kind of stumble there, but it's your chance
Yeah.
to showcase a genuine connection, I think.
So walk me through this. So
Yeah.
the video, it gives like a top scoring answer.
Yes.
What makes it so good?
Well, it's not just saying, I need a job, or I've always liked healthcare,
Yeah.
It's weaving in this deep appreciation for the values,
Right.
this desire to, I don't know, to contribute to something bigger
Okay, I see.
than yourself. It's almost like you're joining a movement,
Yeah.
not just clocking in.
That's clever because it shows you've actually thought about
Right.
where you fit into that bigger picture. Patient care, service improvement, all that stuff that makes the NHS stick.
Precisely. And that leads us perfectly
Yeah.
to the next crucial point.
Yeah.
I think the NHS values.
Ah,
These
right.
aren't just like a buzzwords. They're the foundation
Yeah.
of everything.
The video really stresses that
Yeah.
they're not just something you see on a poster.
Right. Exactly.
And you just glance at.
Yeah. You've got to know them inside and out.
Working together for patients, respect, and dignity.
Yeah.
Commitment to quality care, compassion, improving lives.
Mm-hmm.
Everyone counts. I mean, knowing these
Inside and out.
is non-negotiable. Yeah.
So it's not enough to just like rattle them off in the interview, right?
No, you need to demonstrate how they translate into action,
Okay.
A lot of people will list the values, but what stands out is
Oh.
a story that demonstrates it. Like how you applied compassion in a tough situation.
Right.
Or went the extra mile for a patient.
Yeah.
So they felt respected. That's the proof,
That makes me think they're probably even listening for those values
Oh, yeah.
in how you answer the other questions, not just the direct ones.
You're absolutely right. Yeah.
Yeah. Okay.
Every response is a chance
Got
to
it.
show that alignment.
Okay, so we've got the why of working for the NHS.
Right.
We've got embodying the values.
Yeah.
What else is like super key to acing these interviews?
Well, a huge part of these roles,
Mm.
especially those with direct patient care,
Yeah.
is navigating those tricky patient interactions.
Oh, like how do you deal with a difficult patient?
Right. Yeah. And I like that their answer
Yeah.
doesn't shy away from the fact that those situations happen.
Exactly, it's reality.
Yeah.
But it shows a calm approach,
Yeah.
solutions focused.
Yes.
It's by the training, the trust guidelines, communicating clearly.
And always prioritizing safety and care quality.
Yes, all of that.
It shows you're prepared to handle like the tough stuff
Mm-hmm.
while staying professional.
And patient center.
Yeah.
Exactly.
It reminds me of this one time, actually.
Oh, tell me.
I was volunteering at this hospital,
Okay.
and this patient was so upset.
Oh, no.
They were waiting for ages,
No, understandable.
Totally understandable.
Right.
But they were getting really agitated.
Oh, gosh.
And I just remember from a training about active listening.
Oh, nice.
So I took a breath, I approached them calmly,
Good for you.
and just really focused on hearing them out,
Mm.
acknowledged their frustration, explained the situation, and reassured them that I was doing everything I could.
Oh, that's great.
And honestly, it was amazing.
Really?
Just acknowledging their feelings, showing I cared.
Yeah.
It just de-escalated everything.
Wow.
They calmed down. They even thanked me for listening.
That's fantastic.
It was like,
That's a perfect example
wow.
of those values in action.
Wow.
You had compassion, respect, commitment to quality care,
Yeah.
all in that one interaction.
I think that experience really, for me, solidified how important those values are.
Absolutely.
Not just in healthcare, but anywhere, really.
It's about treating people with dignity no matter what.
So we've talked about the why of the NHS,
Yeah.
embodying those values, navigating tricky patients.
Mm-hmm.
Where do we go from here?
Straight into those essential Band 3 skills.
Okay.
This video really dives into what they want.
Okay.
beyond those foundational things.
So it's not enough to be a compassionate person
Right.
who loves the NHS.
Exactly.
You need the practical skills to back it up.
Absolutely. And it's not just listing them on your CV.
Yeah. Yeah.
It's about showing how you've actually used them.
Okay.
They highlight patient care, communication, understanding guidelines,
Right.
workload management, resilience, professional development, teamwork.
Wow, that's a lot.
It is. It is.
How do you even begin to showcase all of that?
That's where storytelling comes in.
Okay.
Think of situations where you demonstrated those skills successfully.
Give me an example. So let's say communication skills.
Okay, think about a time you had to explain like complex medical info
Right.
to a patient in a clear and empathetic way.
Yeah.
Or maybe a tough conversation with a colleague
Okay.
where you stayed diplomatic, professional.
I see.
Those real examples, they bring it to life for them.
So it's like you're building a case for yourself,
Precisely.
like a lawyer in court.
Exactly.
Each story is a piece of evidence.
Yes, strengthening your argument that you're the right person
Got it.
for the job.
So it's not just having the skills, right?
It's about being able to explain
Articulate it, yeah.
how you've used them well.
And the more specific your examples are to the role, the better.
I'm seeing a pattern here.
What's that?
It's all about showing, not telling.
You got to wrap up this first part.
Yeah.
They make a crucial point
Okay.
about tailoring your prep to Band 3 questions.
So you need to understand those unique challenges.
Yes, exactly.
And prepare for scenarios based on that.
Precisely. Use the job description as your guide,
Okay.
Really understand what they want
Yeah.
and make your answers count.
So again, it's not just any old answer.
No.
It's showing you've done your research.
Yeah.
And you really want this Band 3 role.
That's the key.
Okay.
It shows commitment that impresses them.
This is all fantastic advice. I feel like we've covered so much already.
Yeah.
But I really want to dig into those specific questions
Me too.
and prep strategies.
Let's do it.
Let's dive into the next part.
And see what other gems we can find.
Sounds good. Now, this next section, it jumps into those interview questions.
Okay.
The video, it mentions a whole other video
Yeah.
with, the top 50 questions and answers.
Oh, wow.
Yeah.
So even without watching that whole list,
Yeah,
are there any question types or themes that really scream Band 3?
definitely, yeah.
Okay.
They touch on a few that get to, the core
Okay.
of what these roles really need.
Yeah.
Like handling pressure, dealing with conflict.
Right.
Those are almost guaranteed to come up.
Makes sense. Band 3 can be pretty demanding,
Oh, yeah.
both physically and emotionally.
Absolutely.
So they want to know you can handle it.
Yeah, you won't crumble.
Right.
It's not enough to just say,
Yeah.
I work well under pressure.
Yeah. Anyone can say that.
Exactly. You need to back it up
Okay.
with solid examples.
So I'd be thinking of times I juggled multiple tasks,
Mm-hmm.
dealt with last-minute changes,
Yeah.
stayed cool when things got crazy.
Exactly. And think beyond just paid work,
Oh, okay.
volunteer roles, community stuff, even family crises.
Right.
Those can all show resilience.
That's a good point. Those unofficial experiences,
Yeah.
they really test you.
They do.
And what about conflict resolution?
Yeah.
Any tips for those?
It's similar to pressure. You got to show, not tell.
Okay.
They want to see you can approach disagreements professionally,
Right.
find that common ground,
Yeah.
contribute to a positive environment.
Okay.
So think of a time you navigated a conflict well, maybe with a coworker, even a friend.
Okay, so concrete stories.
Yes, have those ready.
Pressure, conflict, anything else that comes up a lot.
Teamwork is huge. That's a recurring theme throughout.
Makes sense, these Band 3 roles.
Yeah,
You're often part of a bigger team.
exactly. So you can collaborate.
So prepping stories about successful team projects, how I handled different personalities, all that.
You're getting it, but it's not just what you did. It's how you help the team succeed.
Right.
Did you take on a tough task?
Yeah.
Help a struggling teammate?
Okay.
Step back and let someone else lead?
Ah. So focusing on that we aspect,
Okay.
showing I'm a team player,
You got it.
not just in it for myself.
It's about showing you understand the value of that collaboration
Okay.
and putting the team's needs first.
Okay, so far we've covered why the NHS.
Right.
Those core values,
Mm-hmm.
handling pressure, conflict, being a team player.
Yeah, it's a lot.
Anything else they highlight?
They touch on motivation and commitment.
Okay.
They might ask, where do you see yourself in 5 years?
Right.
Or Why this specific Band 3 role?
Ah, those classic career goal ones.
Yeah.
Those sometimes feel like they want a specific answer.
It's less about the right answer,
Okay.
more about showing you've thought about it
Yeah.
and that you align with the NHS.
Okay.
So for the 5-year
Mm.
question,
Mhm.
instead of I want to be a manager, talk about developing your skills within the NHS,
Yeah.
contributing to improvements,
I see.
making a lasting impact on patient care.
So showing your ambition is tied to the NHS mission.
Exactly, not just climbing the ladder.
Right, right.
And for the why this role,
Yeah.
really dig into that job description.
Okay.
What excites you?
Mm-hmm.
How do your skills fit?
Yeah.
What unique things can you bring?
This is gold. It's like we're cracking the code.
I think we are.
It feels way less scary now.
Yeah, we're getting there.
And speaking of cracking the code,
Oh,
they mention another resource.
okay. Tell me more.
Their website, howtobecome.com,
Right.
they've got a whole section on NHS interviews.
They do. They do.
Okay, so even more help.
Yeah.
What kind of stuff is on there?
Well, they mention a full list of 50 Band 3 questions
Wow.
with answers, detailed guides.
That's amazing.
Yeah.
So it's like a one-stop shop
It is.
for anyone who's nervous.
Absolutely. And they mention tips on body language.
Uh,
What to wear. They cover everything.
Okay, so let's recap.
Okay.
We've talked about why you want to work for the NHS,
Yeah.
knowing those values inside and out,
Mm.
showcasing those Band 3 skills.
Right.
We delve into pressure, conflict, teamwork,
All important.
plus those extra resources for prepping.
Absolutely. And remember, showing those skills with examples,
Yes.
tailoring your answers to the specific role.
It's a lot, but it feels manageable now.
I think so too.
It's like preparation is key.
It really is.
The more prepared you are,
Mm-hmm.
the more confident you'll feel.
Exactly. And that confidence will show.
It's all about showing them you're the right fit
Yeah.
for the role and for the NHS.
Spot on. And that brings us to the final point.
Okay.
It's about going beyond just wanting the job.
Ooh, I like that.
Yeah.
What do they mean by that?
It's about your why.
Mm-hmm.
Why are you drawn to the NHS?
Right.
What motivates you to contribute?
Okay, connecting with that deeper purpose.
Exactly. Understanding the impact your work has. Yeah. On people's lives. Being passionate about that.
I can see how that would make a difference.
It does.
It's the difference between someone who just wants any job
Yeah.
and someone committed to the mission.
Precisely. That passion will come through in your answers.
Right.
It'll set you apart.
It's like, yeah, you're prepped, you've got answers,
Mm-hmm.
but it's that heart connection that matters.
I couldn't said it better myself.
Yeah.
It's where your skills, experience, and passion all meet.
That's inspiring. It makes me want to apply myself.
Huh. Well, maybe after this you will.
Okay, we've covered so much.
Yeah.
Before we wrap up part 2,
Okay.
I want to go back to something they kept saying.
Mm-hmm.
Tailoring your answers to the specific role.
Yes. So important.
It's about showing you've done your research.
Exactly.
You understand that specific Band 3 position, so it's not about generic answers.
Yeah. No, tailor them.
Right. You take the time
Yeah.
to understand the
The
responsibilities,
challenges, yes.
and you show how you're the perfect fit.
That's
So really digging into that job description,
it's cool.
highlighting how my skills match what they want.
And if you can weave in examples
Yeah.
showing you get those specific challenges.
Right. Like if I'm applying for a healthcare assistant role,
Mm-hmm.
I might talk about a time I handled a difficult patient well.
Perfect. Or for an admin role,
Yeah.
you'd highlight your organization multitasking.
It's showing them you don't want any job.
Yeah.
You want this job,
Exactly.
and you're ready to excel.
And that will impress them.
Okay, I think we've got all the wisdom from this video.
I think so.
Any final thoughts?
Just this, remember, it's a conversation.
Okay.
Be authentic, be enthusiastic.
Yeah.
Let your passion for the NHS shine.
And we can't forget about those extra resources.
Like, absolutely not.
That bonus video with the 50 questions
Yep.
and the How to Become website. That's amazing.
Those are game changers for sure.
Yeah,
Knowledge is power, right?
it really is.
Especially heading into an interview.
Yeah,
The more you know, the more confident you'll feel.
for sure.
And that'll show.
It's like you're not just showing up.
Right.
You're showing up ready.
Prepared.
Yeah,
Ready to impress.
exactly. And it's not just what you say either.
Oh, right.
It's how you say it.
Yeah.
Enthusiasm, it's contagious.
Oh, totally. Nobody wants to listen to, like,
A robot, yeah.
a robot reciting answers.
No personality.
You got to let your personality shine through.
That's what makes you stand out.
It's about showing them you're a human
Yeah.
who's excited about this opportunity.
Passionate
Yeah, passionate about making a difference.
and wants to be part of the NHS.
Yeah.
That's it.
Okay, so To wrap things up, think about your why,
Yes.
prep those answers, check out the resources,
All of it.
and most importantly,
Believe in yourself.
yes, believe in yourself.
You got this.
Go out there and ace that interview.
We're rooting for you.
We are. Good luck.